Well, amid the showdown over the brutal rape and murder of the woman doctor at RG Kar Hospital, the CBI probe is also deepening in the case. For the very first time, the CBI has questioned Dr. Sandeep Ghosh, the former principal of the hospital. Other top bosses of the hospital and staff who were present in the hospital on the night of the crime have also been quizzed by the CBI. The CCTV footage is being closely examined and the phone of the accused has also been sent to forensics to track his movement. Now, according to sources, the CBI team has come to know that on the fateful night, the victim and her friends had ordered food from an online app post-midnight. The 4 colleagues who had dinner with the victim have also been questioned by the CBI team, and even the delivery boy who delivered the meal has been grilled by the Kolkata police. The big question now arises is when the crime took place and who all were involved in it. According to sources, the accused in police custody, Sanjay Roy, first visited the hospital at 11 p.m. and came out within 30 minutes, whereas the victim was seen sleeping at 3 a.m. However, the accused Sanjay Roy again visited the hospital between 3:45 to 3:50 a.m. and came out in just a few minutes. The initial autopsy report states that the accused died 3.5 to 4 hours after having her last meal. The CBI is now trying to connect the dots to nab all the accused in the case. But let's take you through the top developments in the case. Now, the CBI sleuths have stepped up their probe, and Sandeep Ghosh, the former principal of the RG Kar Hospital, has been grilled by the investigators. And this grilling went on till early in the morning. Even as the Mamata Banerjee government is being accused of being lackadaisical on the issue, the West Bengal government has transferred over 40 doctors. The BJP alleges that these doctors were transferred for protesting against the Kolkata horror. On the other hand, the Indian Medical Association's 24-hour nationwide bandh has also begun. Remember, the emergency and casualty wards continue to be operational, though. There's another significant development. The rape and murder case reached the corridors of the Supreme Court with 3 letters written to the Chief Justice of India seeking suo motu cognizance of the issue. Now, on the 14th of August, the RG Kar Hospital vandalism case as well, the Kolkata High Court directed the police to file an interim report on the vandalism and provide security to the protesting doctors. Now, let's also tell you that the ex-RG Kar Hospital principal, who is currently at the CBI office, Times Now has confronted him, Mr. Sandeep Ghosh, as he was returning from the CBI office. This comes amid the charge that he is politically connected and he was being shielded by the Kolkata police. Listen in.
ফলস ইনফরমেশন দেবেন না আমাকে সিবিআই অ্যারেস্ট করেনি। প্রথম কথা, আমাকে জিজ্ঞাসাবাদ করেছে। দ্বিতীয় কথা, আর এটা পুরো আন্ডার ইনভেস্টিগেশন আছে, সেজন্য আমি কিছু বলতে পারবো না। বাট আপনাদের কাছে একটা সবিনয় অনুরোধ, প্লিজ রিউমার স্প্রেড করবেন না। আমাকে আরেকটা যেটা আমি দেখলাম কিছু মিডিয়াতে, যে সঞ্জয়কে সঙ্গে নিয়ে বসি, এগুলো কিন্তু পুরো ভুল। এরকম কোনো এরকম কিছু হয়নি। আমাকে ওনারা জিজ্ঞাসাবাদ করেছেন এবং খুবই ভালো ব্যবহার করেছেন, হ্যাঁ, এবং কোনো অসুবিধা নেই। ধন্যবাদ। আন্ডার ইনভেস্টিগেশন
মাস্টারমাইন্ড বলছি এসে গিয়েছেন। অর্থাৎ যে কথা তোমাকে বলছিলাম যে সন্দীপ ঘোষ তিনি কখন আসবেন, বাড়ি থেকে তিনি বেরিয়েছিলেন, সরাসরি যে ছবি দেখা যাচ্ছে সন্দীপ বাবু গতকাল জিজ্ঞাসাবাদ আজকে কি বলবেন?
So, Sandeep Ghosh has been questioned by the CBI officials and the grilling went on for several hours. We'll get you more details of what were the questions that were posed at him. This comes at a time when the court had also pulled up the Kolkata police and also asked about the role of the hospital officials. Now, remember, several questions have been raised. The BJP also alleging that there is a political link to it as well in the protests that have been taking place. The doctors have also been demanding not just speedy trial and justice for the victim, but also ensuring security for the victims. In fact, they have also spoken about several lapses in the hospital over the last several months, and yet no action being taken. So now the CBI continues to question the key accused in the case, yes, and also the principal in the case. The principal has also been questioned for several hours. In fact, sources saying that he was there at the CBI office until early in the morning. So the grilling went on for several hours. In fact, sources also say that he has been summoned yet again for questioning. Meanwhile, the court also pulling up the Bengal government over the vandalism that took place at the hospital. My colleague Tapas is joining us over the phone line with the details of the CBI investigation. Tapas, the CBI has questioned the former principal of the hospital. What are the details? How many hours was he questioned for? Do we have any details of what the line of questioning was?
Well, see, yesterday, Sanjay Roy, the former principal of RG Medical College and Hospital, was questioned for good 14 hours, and after that, he went home, and some documents were sought from him. And today, sharp at 10 a.m. in the morning, Sanjay Roy reached CBI office, and he is being interrogated right now. We have been told that his statement is also being recorded. Yesterday, apart from him, several Group C and Group D of the RG Medical College hospitals were also summoned yesterday late in the evening, and their statement also got recorded. And in the meantime, we saw that around 45 minutes back, a technical team of the CBI have left for the crime scene once again. This is perhaps for the third time. They are carrying laser scanning machines along with them, and in all likelihood, there would be a reconstruction of the crime scene to have a fairer idea exactly how things have transpired, how crimes could have transpired. That will only help to take the investigation forward. Overall, at this moment, a team of CBI is there at RG, and the former principal of RG Medical College and Hospital, Dr. Sanjay Roy, is being interrogated. A marathon interrogation is going on for the second consecutive day here at the CBI office.
Okay, all right. Tapas, thank you for joining us with those details. We'll continue coming back to you for those updates because sources say that he has been summoned yet again. But remember, the IMA's 24-hour Bandh is currently underway. The Bandh is going to continue till 6 a.m. tomorrow, and only the emergency and casualty wards are going to be functional. So the doctors continue their strike. The Bandh that they had called will continue till 6 a.m. tomorrow. My colleague Jayalakshmi is joining us on the broadcast with the details. Jayalakshmi, this is a Bandh call or a strike call that has been given across the country because the doctors and the medical professionals have spoken about the risks that they face at the workplace. You're at the protest site. Take us through what are the key demands.
You know, seriously, you can see the amount of doctors who have gathered. It is across the, private and government hospitals from the state of Kerala. They are representing various hospitals, the dental, the RCC, the medical colleges, the private colleges. All of them have joined together for one cause, and their slogans are, "We want justice." People who are saving the lives of the doctors, people who are on, people who are on ground saving life of every other common person here, is their lives. Life is at stake is what their question is, and the demand is the central protection, implementation of the Central Protection Act, and the failure of these laws. Even though such laws exist in the system, there is no way these people are safe, and that is in turn affecting the system and the safety of the patients as well. That is what let us talk to one of the doctors here. Sir, we know that the laws, multiple laws are in they're implemented, but again, such a safety concern over the doctors. What do you have to say about it?
So already I said last time, the safety not only for the doctors, as well as healthcare professionals. It's already the safety for our common patients, especially those patients, the poor patients. They are approaching the government hospitals and government medical college. So first of all, we have to give proper facility and proper resting room and proper security to not only to the doctors but also to all the healthcare professionals, including these nurses, paramedicals, and all. And then only we can have a fearless and free. We can give fearless and free treatment to our patients also. And this is not only a crime against a doctor; it's a crime against a lady. The lady cannot be left behind as the Nirbhaya case. We know that, and even so many acts are there. Even the politicians and the police force, part of the police force and the politicians are supporting these such criminals across India, and that's what happened in West Bengal. We heard that the police were just simply sitting there while these criminals and gundas are vandalizing our peaceful protest. And that's not what happened in a democratic country like India. We need to have a civilized culture, and all our institutions, and especially healthcare institutions, should be made safe, protected areas. We need a central act under Bharatiya Nyaya Samhita so that it will have a little more, it will get a deterrent effect against the criminals as well as the politicians as well as the police force, so that they will book the culprits and we will give a proper punishment to the culprits. So then only we can, in future we can avoid such incidents.
Exactly, as we were discussing, so many laws in place, but again, still a question, the safety of the doctors who are, working day and night, who are working more than 36 hours, 48 hours to ensure our safety, the public safety, their life, their security is at stake. And, you can see the amount of doctors who have joined here, they are fighting for this justice of safety, ensuring safety of the doctors.
All medical professionals. Jayalakshmi joining us live from Thiruvananthapuram. Jayalakshmi, thank you for joining us. Protests taking place across the country. And remember, the victim's father had also questioned the hospital authorities, saying that she had spoken to her mother at about 11:15 p.m. and despite being on call, no one even looked for her. These are the questions that the distraught parents are asking. They say, how is it that no one needed her from 3 a.m. to 10 a.m. and no one noticed that she was not there despite her being on call, saying that they called her in the morning, the phone kept ringing, and it was very clear that she was facing problems. The entire department should be investigated and should come under the scanner. Listen in to the father's appeal.
और मेरा सुबह में मेरा लड़की ड्यूटी में गया था 8:10 से निकला उसको ओपीडी था 5 बजे माँ के साथ बात हुआ था फिर 11:15 का टाइम में भी माँ से बात हुआ था वो बोला हम लोगों का 4 आदमी का खाना आया है हम लोग खाना खा रहा है आप लोग खाना खा के सो जाइए तो ऐसे ही बात होता था सुबह में हम घर में नहीं था हम काम में था वो लड़की मेरा माँ को फोन किया था माँ बार बार फोन कर रहे थे फोन रिंग हो रहा था लेकिन कोई उस टाइम मेरा लड़की गुजर ही गया है हमको सबसे दिक्कत का प्रश्न ये है कि रात 3 बजे से सुबह 10 बजे तक किसी का जो ऑन ड्यूटी डॉक्टर है उसका किसी को जरूरत नहीं पड़ा यही एक हमारा सस्ते ना गया मन में जो रास्ते में जितना आदमी है वो मेरा लड़का लड़की समान है हमको लगता है वो मेरा लड़का लड़की बन गया अभी हमारा एक लड़की चला गया इतना करोड़ लड़का लड़की मेरा साथ आ गया यही मैं उसने मेरा हिम्मत बहुत बढ़ा दिया हमको इसलिए लगता है कुछ ना कुछ मिलेगा हमको थोड़ा उसका दिक्कत था कॉलेज पूरा डिपार्टमेंट इसलिए डिपार्टमेंट को हम बोला डिपार्टमेंट पूरा सस्पेक्ट में है
Tapas is joining us live on the broadcast. Tapas, we heard the heartbreaking appeal from the parents who asked some very pertinent questions. This is a doctor who was on call, on duty at the hospital premises, and despite that she was missing for several hours. Did no one notice that she was not present there? It was her parents who had a conversation with her last at about 11:15 p.m. after which they called in the morning. Her phone was ringing, no answer. We can understand the questions that the parents are asking, and this raises several questions on the hospital authorities.
Well, yes, absolutely. The parents have been hinting upon a larger conspiracy that could have been hatched against their daughter. And very rightly, he said that since she was a doctor on call and she went missing for such a long time, but still nobody felt like reaching out to her or trying to find her. Because in government hospital in West Bengal, we see that the emergency wards are especially overburdened and the number of patients at times go beyond the control of the on-call doctors or the junior doctors on duty. So having said that, in such a busy hospital like RG Call, where the patients keep on pouring